Dr. Kemi Olunloyo, Nigerian pharmacist, journalist, and PR specialist. It's the 21st of June, 2024. A day ago, I had an argument with Larry Akitobi, who calls himself Niger Farmer, NIG_Farmer on X, formerly known as Twitter. The argument surfaced around being an agricultural personality on Twitter, X, versus being a medical professional. Now, many people witnessed this, and a lot of Nigerians disrespected and abused me because Larry disrespected and abused me. He started calling me Sissy Kemi. That's not my name on my professional platform. You're on your professional platform. You don't call me Sissy Kemi. My name is Dr. Olunloyo, Dr. Kemi, or plain Kemi Olunloyo. Okay? He gave his followers the authority to disrespect me. Okay, I'm used to that. All right, because many of his followers are not intelligent people. They're brainwashed. Larry is a farmer, an agricultural personality. I don't know what he studied. Maybe he studied agriculture, which is what I'm believing he studied. But he wrote a book about home remedies. There is a thin line between home remedies and the medical profession. And this is what brought me to his page. About 2 months ago, Larry tweeted about bitter cola. He told people not to take malaria medications and to take a home remedy, chew 3 bitter colas, and in 1 hour the malaria would leave their body. I commented and I said this is absolutely wrong. Never ever do this. Never ever do this. He came into my DM and he said, but it works. It's been working for everybody. And I even have some research to back it up. Now he slapped my DM with tons of papers, and I just looked at some of them. I saw Uniben, some research from Nigerian, whatever. I was not interested. The Journal of the American Medical Association, JAMA, is what we use. I'm a US trained pharmacist. Even if you're not a pharmacist, you shouldn't be recommending bitter cola for people you don't know. Do you know if they are on medications? Did you ask them? That's the job of a medical professional, a doctor or pharmacist. Bitter cola has a lot of caffeine. 1.15 milligram of caffeine in one small bitter cola. You told them to chew 3. So they're going to get about 4 milligrams of caffeine in their body. You don't know if they're on high blood pressure medications or heart medications. You have to be careful. Bitter cola's amount of caffeine will cause palpitations in people. Their heart will be racing, and before you know it, they have a heart attack. You cannot give that kind of medical information, Larry. So then he said, I sent you a DM. Show us the DM. Well, unfortunately, the whole stuff was so spammy, I deleted it. But the tweet is there. So he said to his audience that I'm lying about a DM. Who would send you a DM? His audience believed him. Because, of course, you know what I mean. They're brainwashed, unintelligent people. At the end of the day, the point remains that some of the stuff he's telling his audience, I tagged NAFDAC and the Federal Ministry of Health, who are not going to do anything about it. The argument became so fierce, and I told people, please don't buy his book. Go to your doctor and pharmacist. His book sold, he claims, record sales overnight. He tweeted thanking me and said I should send my email. He wants to send me a free copy. No, I don't want a free copy of your book, Larry. I don't. Somebody clearly tweeted you that before you can write a book like this, you should be working on the side with doctors or pharmacists in giving this kind of advice. A woman says she boiled onions and something else from Larry's home remedy book, and her children don't cough anymore. That it works really good for cough. I don't buy cough syrup for my children anymore. The woman says she doesn't buy cough syrup for her children anymore. This is very disturbing for me as a consultant pharmacist, because that's what I do now, I consult. If a woman has a child that has a cough, you don't stop buying cough syrup. You go to the doctor. You take your child to the pediatrician. Coughing is a sign of something else. Some of us eat peanuts, candies, and we cough. We're literally choking. We drink a glass of water, it stops. Now, if persistent coughing happens, that child might have an upper respiratory infection, URI, or an LRI, lower respiratory infection, or pneumonia. And those can kill you. If a child has pneumonia and you're doing home remedies, those can kill you. People are being brainwashed by Larry's books. Okay, as much as I talked really negative about that book, and he sold a lot, it's not about selling Larry. It's about giving medical information, and you're not a medical professional. And you heard exactly what that person said to you. You shouldn't be writing such a book or giving medical advice. It's the same thing I told you. Okay, nobody's jealous of you or your book. I'm sitting here, I can write a book that would sell 1 million times past your book because it's coming from me, a pharmacist. That's not, the point we're talking about. No one's jealous of your work. You disrespected me. You called me young woman, stupid terms. I'll be 60 next month. Okay, and now you're calling me ma'am. Please send your email. Thank you, ma'am. I sold this, I sold that. You don't know I have a degree in PR, right? I give free PR advice all day long. Look at the one I gave Hilda. Look at the one I give so many celebrities. I could be collecting millions and millions of dollars. Look at the ones I've given the Nigerian government to get them to monetize Facebook, to do this, to do that. Nobody appreciates me in that country. That's why I left. I don't need to be anywhere where I'm not appreciated. Okay? And if you think I gave you free PR and your friends and all your fans are boasting, enjoy your money. But you are going to kill people, Larry. You are going to harm people. And some of them may come for you. Another woman said you asked her to boil something, onions or something for toothache pain. The toothache is gone. We're not saying that home remedies are not good. Home remedies are only designed for people when they cannot reach their doctor. In the middle of the night, doctors are where you can go to the clinic, another doctor will see you. But times when you can't reach anybody at all. And in Africa, most of the pharmacies close. It's not like America where they're 24-hour pharmacies. And American pharmacists are clinical pharmacists. That's why we're called doctors. So we can diagnose certain things, even in the pharmacy at 2 a.m. when the doctor's not there. Emergency rooms are still open. But Nigerians generally don't like to go to the hospital because of the money involved that they have to pay. It is very, very important that people know this. Larry's argument with me started because of GMO. Okay, genetically modified organisms and foods. I'll do that in a separate video. But for now, what I want to tell you, I'm a very powerful influencer in media, in pharmacy and health, as well, okay, as public relations. So what I want to tell everybody right now, if you like, you can buy the book, if you like, whatever, but listen to my advice. Home remedies are not something that's chronic. People are sitting on home remedies. If you're on medications that coincides and collides with the home remedy, you die. It's that simple. The woman that said she boiled onions and one of your concoctions for a home remedy, toothache pain, should really be going to the dentist. Because a toothache pain is also a problem underlying in the tooth. I think it was for a kid. That child might have cavities, and the teeth may need to be drilled and filled. They're going to sit down like that, and then when the child comes back from school, I'm aching again, they'll boil that onion again. They wouldn't go to the dentist. These things are wrong. Larry, at least go and learn how to counsel patients. If you don't know how to give information, you're playing with fire, and I've warned you. Thanks for watching. I'll do the GMO one after this video.